So one suggested efficient workflow that I utilized when using DAX Copilot or even dictation is I'll spend the majority of the time within session updating the exercises, not only the ones that are appropriate for home, simply by selecting or unselecting the ones that are assigned to the patient, and or if I need to make unique changes to the instructions, I can be doing that within session. But the key in the printout for documentation would be I would go to the prints. I tend to use the 10 per page. Certainly patients have their personal preferences as to the other formats in which it is printed, so you could select multiple if you so choose. I would then click print. That will give me a print preview of the exercise program. Now, not necessarily will you include all these within your documentation, probably only the ones that you've done. So let's say we've done like the last 6, for instance. On the PDF, you can just copy not only the exercise name, but also the prescription very efficiently. I would then be in my note, so optional to document it within the actual body of the note where it prints or pastes very friendly in with the exercise title and then the prescription below. And so that, again, that's an optional paste if you so choose. I like to keep a record of the interventions over time, just for ease of clarity for my future self. That being said, where it is necessary would be within the actual treatment section. And so I can just simply copy and paste that same information there and hit accept. And if I went back into it, you can see I've done it a couple times as examples, and I could also manipulate it if I so choose. And then it's all right there, and my documentation is done for my interventions. And that's an efficient way, especially because as of right now, the DAX Copilot doesn't effectively or efficiently capture the content for exercises, simply because there's not a designated section necessary for it. Sometimes it will populate in your assessment if you have particular dialogue around the exercises within session, but that's not always the case, and nor does it usually lay it out with the prescription as shown there. So that would be one suggested efficient workflow for how to get around the inefficiencies of DAX Copilot for your interventions and treatments.